So welcome everyone to today's free webinar hosted by Prevention Plus Wellness, LLC, located here in beautiful St. Augustine, Florida. My name is Dr. Chudley Wirch, and I'm CEO and founder of Prevention Plus Wellness. Again, thank you so much for joining us for this webinar. We'll have about an hour together. I suspect the slides will take about 45 minutes, 50 minutes, and then we're going to open it up to Q&A. So as we go along, if you have questions, if you have comments, if you have insights, if you have concerns, find that Q&A space and type it in. And I'll take those questions in the order that they've been entered. So let me see. This is your time. So if you use it any way you want, if you focus on this information, I think you'll gain some very good information that has practical implication for what you may be doing as prevention and health specialists. I will be sending everyone who is registered for this a certificate for 1 hour of CEU. You just need to type your name in the certificate if you're watching this. I'll also send you a link to our website where you'll be able to look at the slides that I'm presenting today, and I'll have a link of this recorded session if you want to share it with others. Okay, so you can see today's topic. It sort of underpins all that we do here at Prevention Plus Wellness, that is integrating substance use prevention with wellness. Holistic prevention is the term I like to use. So holistic prevention is what I think this is what we're doing by integrating substance use prevention plus wellness. So let me go ahead and dive right in. By the way, this is a 3-part webinar. Today is part 1, tomorrow part 2, the day after that part 3, back-to-back 3 webinars. I hope you can attend all of them, but I know you're very busy, you've got other obligations. But if you register for all 3, you will be receiving a notice, an email from me after the webinar, so you can access the slides, you can access the webinar, recorded webinar. So do register for all 3, even if you cannot make some of them. So, and I think this is the one, this first one is the one that has the most registrants at this time, the last time I looked anyway. So we have given this, I should say, I've been given this webinar before, but it's been significantly altered, enhanced, expanded. It was at one time 1 hour, now it's 3 hours. I don't know where we're going, but my feeling is that, and my bias is that this is really critical to the prevention field. This really needs to be part of the certification process for prevention specialists. Wellness is essential to holistic prevention and to us doing our jobs fully, most effectively, and most broadly. So I really feel strongly about that. And I hope you will too, once you've viewed this webinar and this series of webinars. So the overall purpose of the 3-part webinar is to gain an understanding, that's you guys, to gain an understanding of wellness, what it is, and what is its essential role in holistic substance use prevention for enhancing the overall health, mental health, physical health of youth and young adults, or whoever is our target in our prevention practice. So today's webinar, part 1, has 3 objectives to describe. We'll start out describing some of the models of wellness, what wellness is all about, and how it relates to substance use prevention. Then we'll go on to discuss and to identify, I should say, how youth are at risk for not just substance use, but mental and chronic disease risk factors simultaneously. This is your typical, and the majority of youth in the United States and even abroad are at risk for multiple health risks, not just substance use, but others associated with mental and physical well-being. And lastly, We're going to look at actual data from the Youth Risk Behavior Survey. We're going to use those data to look at associations between wellness behaviors, particularly physical activity, and sports participation, and getting adequate sleep, 8 or more hours, and eating breakfast every day. Those health behaviors in relation to substance use and mental health and physical health outcomes for U.S. high school adolescents. All right, that's what's on the docket for today. So let's go ahead and start looking at it. This is part one of a 3-part webinar. And again, anytime you have any questions, comments, whatever, find that Q&A button and enter your comments, your questions, and then at the end of today's slideshow, we will take a look at those and I'll answer those to the best of my ability. And maybe we could even have a discussion if you'd like to. So let's start out with wellness definitions and models. So I think one of the first, if not the first, mentioning or defining of wellness was back in 1948 by the World Health Organization. And this is a definition that's still mentioned today as sort of as the core for wellness even today. And that is a state of complete physical and mental and social well-being, not merely the absence of disease. So this was the first time that, in this case, the World Health Organization is identifying that to be healthy, to be well, is more than just not having symptoms of illness. And wellness is, without a doubt, if you look at all the definitions, or many of them at least, multifaceted constructs. So many components to this wellness, and we'll discuss some of these so you get a good understanding of what we're talking about. But one thing for sure, there is no agreed upon single definition of wellness. That said, a lot of similarities across the definitions over time. In a paper called High Level Wellness for Man and Society, the person that is sometimes called the father of wellness, Halbert Dunn, in 1959, came up with this article and the health grid to help understand some of the complexity. It's actually not that complex, but it's, I think, a beginning to start to look at what are some of the components of wellness. And this is the health grid that Halbert Dunn came up with in 1959. And what you have here is you got 4 quadrants. You can see the different colors. And you've got 2 axes. The one that's horizontal is a health axis. To the right is wellness. And to the left is death. And then you've got a vertical axis, which is environment. So in the top, you've got an environment which is supportive of wellness. And then you've got on the bottom, you've got an unstable environment, whatever that might be, but that was the term used back then. So, and you can see these different quadrants. So in the upper right-hand corner is the actual goal, I guess, for many of us, if not all of us, and for and for those we work with as prevention and health specialists, high-level wellness. That's what is that, blue or purple quadrant? That's where you have in the horizontal axis, you've got, again, wellness, healthy situation, and you've got a favorable environment. And then contrast that across in the red area where it's poor health, where you've got, again, an unstable environment and you've got poor health. So those are some of the quadrants, just trying to identify some of the components of wellness. That was Halbert Dunn back in 1959. One of the more, I think, commonly cited definitions of wellness comes from the National Wellness Institute. And here's the definition. It's an active process. Wellness is an active process through which people become aware of and make choices toward a more successful existence. So awareness is important. So you may think about this in terms of your clients, your patients, your youth, young adults, whoever you work with as a prevention and health specialist. This is about making them aware of things and having them make the right choices. Now, three components that the National Wellness Institute highlights. Number one, wellness is conscious. There's where that awareness comes in. It's self-directed, it's evolving to achieve full potential. So full potential as a human being doesn't happen by itself, but it's a process by which you decide and think about and work toward. Number two, it's multidimensional. We mentioned that already. Holistic, encompassing lifestyle, mental, spiritual, well-being, environment is involved. So you can start seeing some of these many components, this multi-component, going back to that World Health Organization definition. And it's also positive and affirming. So that's a little bit different because oftentimes in prevention, we'll focus on risk only, but this is a little different wellness, positive and affirming. Now, National Wellness Institute identified 6 dimensions. Some organizations will have 8, 10, 5, whatever. There's differences, but you can see some of the breadth, at least, of what we're talking about. Well, wellness, emotion, physical, occupational, spiritual, intellectual, social. So all of these things play a role in us achieving wellness, working toward wellness as individuals, as groups, and for our, again, our clients, the people we work with, our youth, in fact. Now, the Substance Abuse Mental Health Services Administration has a wellness initiative. So they identified some years ago, decades ago, and in fact, that wellness is really essential to the substance abuse and behavioral health field. So they came up with their own definition. You can see it here. Not the absence of disease or illness, and stress. So they've sort of expanded on the World Health definition by adding stress, which I think is good. So even if you don't have stress, you're not necessarily well, but the presence of a positive purpose in life, satisfying work and play, joyful relationships, healthy body and living environment, and happiness. Even happiness is added. So that's a broadening, I think, of the definition, World Health Organization definition, but this is SAMHSA's wellness definition. And then 3 main pieces or components to wellness. Number one, wellness integrates behavioral and physical health. I think that says it all. It integrates mental and physical well-being and health components. It integrates, from the behavioral perspective, substance use prevention, mental health, and physical health. That's what wellness is. And realizes that the mind and body and these components, behavioral health and physical health, are interconnected, they're interrelated. And when we address just one component, whether that be a mental health component or a substance use component or substance use prevention component, we're not addressing the whole. It's not holistic. Number 2, SAMHSA also identifies wellness as empowering. There's a positive spin to it, aspect of it, and prevention oriented. So wellness integrates prevention. It's prevention oriented. In other words, it's not like disease model, treatment model. It's not after the fact. It's about preventing things that can are barriers to you achieving wellness. Positive goals, learning self-management or self-efficacy or self-regulation skills, developing healthy habits, right there under number 2 highlighted, developing healthy habits, healthy eating, breakfast, sleep, physical activity. These are essential to empowering and to preventing disease problems, substance use, etc. Okay. Thanks for raising your hand. At this point, I'm just presenting. Hopefully you could hear me. If you could identify any questions you have in the Q&A at this time. Number 3, this is again, SAMHSA, Substance Abuse Mental Health Services Administration Wellness Initiative. Number 3, wellness is a journey. It's not a destination. It takes place over our whole lives. And so, in other words, we don't ever reach wellness, but we have higher wellness or lower wellness, but we're continually working toward that mental and physical health and quality of life that is so unique to us. And by the way, everybody's different. Everybody has a different environment. Everyone has different genetic composition, etc. So we're not on the same playing field, but we all can work toward wellness and that's a very important goal. Wellness is multifaceted with interactive dimensions. This is SAMHSA again, and so here they identify 8 dimensions. We just looked at the Wellness Institute that had 6, and so again, some of these definitions and components are different for different models of wellness. But you can see emotional, environmental, financial is new, intellectual, occupational, physical. There's where the physical activity, healthy foods, and sleep come in. Physical health also related to these other dimensions because they interact with each other, social health, spiritual health. In a document called Creating a Healthier Lifestyle, a step-by-step guide to wellness, the improving your physical health component, this again is from SAMHSA, the first 4 items sort of sum it up. A holistic prevention, nutrition. Do you have access to healthy foods, but do you also choose to eat them? Number 2, physical activity. Are you regularly engaged in a physical activity? Sleep. Are you getting adequate sleep and high quality sleep? And then lastly, are you avoiding substance use if you're a youth, and then as an adult, certainly misuse? All of those things essential, particularly to that physical realm, but remember that physical realm impacts the other dimensions, mental health, etc. We've even seen more recently a focus on wellness in the nation's goals for healthy, for health, national health goals through the health-related quality of life and well-being. Healthy People 2020 is, I think, the most recent version of health goals for the nation. They're written every 10 years, I believe. There's a new goal, Healthy People 2020, and the new goal is improve health-related quality of life, HRQOL, health-related quality of life for all individuals. So getting beyond just maybe reducing substance use or reducing illness or increasing physical activity, we're talking about something broader than that. So we're talking about well-being, we're talking about wellness. Number 5, not the traditional view of prevention of just minimizing illness or substance use or risk factors, but focusing on something more positive, broader, resilience, resistance, self-efficacy, and self-control, and happiness, all these things that are part of wellness and well-being. So why wellness and substance use prevention? I had a couple thoughts on that. Certainly SAMHSA have some thoughts on that too, because they've identified that wellness is essential to successful substance misuse treatment and recovery. They don't. It's sort of interesting. SAMHSA really doesn't touch much on how important wellness is to prevention, but it is. They sort of focus, unfortunately, only or more exclusively on the fact that wellness is essential for those in treatment and recovery. In other words, a wellness components, lifestyle focus, et cetera, goals important to recovery and treatment, but also to prevention, as we'll be discussing in these 3 webinars. Number 2, people with serious mental health, substance use disorders are dying decades earlier of preventable chronic diseases. And so that's why SAMHSA decided it's essential to go beyond just treatment, and as a part of recovery, wellness promotion is essential. Number 3, prevention of substance misuse is a key component of achieving and maintaining wellness. We've seen that in the definitions we just looked at and the components we just looked at, from SAMHSA to even alluded to the World Health Organization, et cetera. Youth and young adults, number 4 I'm looking at now. Youth and young adults are exposed to multiple concurrent health risks, not just substance use, excuse me, but the risks to their physical health, their mental health, their overall well-being. And so holistically, by the way, these are all interrelated with substance use. And so we want to interact. We want to, excuse me so much. We want to address them because they interact and influence each other. And that's number 5, these interact. So for example, just crudely speaking, healthy behaviors support each other and are likely to help prevent substance use and mental health problems. Substance use and mental health are going to likely to influence in a negative way healthy lifestyles and physical and mental health. So that's the relationship. Poor sleep increases substance use risk increase the likelihood of poor sleep, just to give you an example. What are some 6 particular reasons for integrating prevention and wellness? Here's again from my own review of things. Number 1, young people are exposed to multiple health risks, not just substance use, but these others. So there's a need for addressing, having a more of a broader holistic approach. Number 2, wellness fits with and completes substance use prevention by the definitions we looked at. Number 3, wellness improves mental health. And we're going to be looking at some of the data and some of the research to support this over the next 3 webinars. Number 4, wellness wellness empowers one to choose positive identities and behaviors. And again, that's part of wellness, to focus on empowering an individual. So beyond the prevention, it's in addition, wellness empowers lifestyles and identities, really important, particularly for youth who are still in the identity development stage. Number 5, wellness is prevention's ultimate goal. That's what I believe, rather than just, I think we would all feel better if we not just prevent something from happening, but we could actually see something positive happening, positive behaviors, positive choices, positive identities being developed, and that's that wellness piece. And lastly, wellness promotes, to a certain extent, protects against substance use to a certain extent. So very, very important. Now, I know you've heard about the brain science with regard to substance use. I know in particular, for those of you that are prevention specialists, I know that we focus particularly on prevention, but there's more than, there's implications for brain science, not just for prevention, but from wellness. So number 1, I know most of you are probably familiar with the prefrontal cortex. Takes time to develop, maybe even into the mid or a little bit later 20s. And so a decision-making and impulse control can lead to risky behaviors, and substance use can interfere with the functioning of that prefrontal cortex. So you'll hear this a lot in highlighting the importance of prevention, substance use, and other risky behaviors. But look at number 2. Don't forget, the brain is highly plastic, fluid, flexible. Plasticity is the term used, which allows it to change, to adapt, to respond to its environment. So that means that positive experiences like physical activity can really have a very a positive influence on the brain development and shaping. So keep that in mind. That's where wellness behaviors and other pro-social behaviors, for that matter, can really have a really important developmental influence on young people. So that plasticity component. Other wellness risk factors, number 3, mental health disorders oftentimes emerge during adolescence. Adolescents may be more vulnerable to stress, requiring, again, health behaviors to protect that, whether that be physical activity, nutrition, sleep, all those combined, and even stress reduction, relaxation approaches. And then lastly, number 5, teens need more sleep. They need more sleep. Their brains need more sleep. Their bodies need more sleep. And yet they have greater melatonin levels later at night. So there's a bit of a challenge. In other words, they have a problem going to sleep earlier. So there's some brain health science there in relation to prevention and wellness. So now let's take a look at some risks. We're going to start looking at health risks, the breadth of health risks among our adolescents. These data you're looking at, this is U.S. high school adolescents, most recent data from Youth Risk Behavior Survey 2019. This is substance use. Look at the bottom of the scale and then go up. This is the percentage of ever using. In other words, have they ever used any of these in their lives? So you can see 6 out of 10 have used alcohol, half have used e-cigarettes, over a third marijuana, about a quarter cigarettes, and about 14% opioids. So you got all these happening, not individually, but at once within individuals, within populations. You got substance use risks, and you got multiple substance use risks that can lead to addictions and even acute harm like substance use and driving. What's going on with substance use over time? This chart shows the changes over time, over a 10-year period. And as I think many of you have heard, not that we like to promote it, because I think we more often like to promote the, things are, the sky is falling, there's more risk, there's more problems. We don't like to promote to the general population that things are getting better, but in fact they are for some substances. So we see, for example, for current alcohol use, that's 30-day use, we see about a 6% drop over the last 10 years. Of course, cigarettes are the big winner from a prevention perspective. We see, almost a 24% drop over 10 years. But marijuana sort of flat, but we do see an increase in e-cigarettes. In fact, the data there is for only 4 years. We see a 5% increase in e-cigarettes over 5 years. We see a slight uptick in opioid illegal and non-medical opioid use over just 2 years. So it's a mixed bag I want to share with you. So even though there's declines over time in alcohol use, particularly cigarettes, there's an increase in e-cigarettes, and then there's looks like an increase in opioid use. So mixed bag over time with regard to substance use. How about some of these other risk factors associated with mental and chronic disease? Let's look at the top of the chart and then go down. Let's start with physical activity. The recommendation for for youth is an hour of physical activity every day. Not even a quarter of U.S. high school adolescents are getting that. And at the same time, going on half of the high school adolescents are getting 3 or more hours of video game playing. So you've got this issue of physical inactivity, okay? Associated with mental health, associated with chronic disease risks. Below that, 8 hours of sleep. Some adolescents need more. Just a little bit over 1 in 5 high school adolescents are getting 8 hours of sleep every day. Okay, sleep critical to mental and physical health. How about nutrition? Eating breakfast. Only a third of high school adolescents in the country are eating breakfast. We don't know even how healthy that breakfast is. That's only 1 in 3 eating breakfast every day. And then other nutritional factors, 3 veggies a day, only 14% of high school adolescents getting that, and not even 29% eating 2 fruits a day. So physical activity or physical inactivity, sleep, breakfast, and nutrition, you could see these risk factors for mental and chronic disease to be even more prevalent among high school adolescents in the United States than substance use. How about the trends in the last 10 years? Well, their trending is worse. Physical activity is going down, sleep down, breakfast eating down, fruit consumption down, veggies sort of flat, and the only thing going up is the amount of video video use, video time. So almost all of these health promoting behaviors are moving in the wrong direction over the past 8 to 10 years. There was a great study published in 2016, a longitudinal study looking at patterns of adolescent health risk behaviors. They found only 4% nationally met all health behavior recommendations, almost, it's almost nothing. And yet 10%, more than 10%, had over 5 health risk behaviors by the age of 16. Of course, that's likely to go up age 17, age 18, as we know risk factors go up. So we've got only 4% following all the health recommendations, more than 1 in 10 having greater than 5 risk factors at an early age of 16. And they also found that for adolescents that didn't eat fruit and vegetables, didn't eat breakfast, were overweight, were physically inactive, or smoked, all of those behaviors predicted other health behaviors, showing that interaction of health habits. So some risk behaviors predicted future risk behaviors. And so the authors, these researchers, highlighted prevention targeting multiple risk behaviors definitely needed among American adolescents. What are the recommendations? What are the youth health behavior guidelines? We've sort of alluded to them already. And this comes from different health organizations, but largely governmental organizations or large health foundations. 1 hour of physical activity for youth every day, 8 hours of sleep every night. We're talking about adolescents now. These are minimums, by the way. 3 vegetables a day consumption, 3 servings of vegetables, 2 servings of fruit a day. Of course, from a prevention field, avoiding substances, alcohol, drugs, e-cigarettes, etc. And I've added to that practicing a daily relaxation technique. Could be, meditation, could be prayer, could be walking in nature, something that's done to help address the daily stress of life. From the broad perspective, looking up above, looking down the high from a balloon looking down, what are the benefits of a wellness lifestyle, particularly in relation to prevention? It's the first line there. Healthy nutrition, sleep, exercise is associated with less mental health problems, depression and anxiety, unsafe sex, also less alcohol, tobacco, illicit drug use. So that sort of says it all in terms of the relationship between healthy living, wellness lifestyles, and substance use and other risk behaviors. But you can see all these other benefits too: improve physical and mental health and quality of life and development, self-image, self-esteem, brain development, opportunities to socialize, academic success, and then less chronic disease, all associated with lifestyle behavior. Okay, so now let's take a look at some data. So what we're going to be looking at now is we're going to look at associations among adolescent wellness behaviors, particularly physical activity, getting again the guideline, 1 hour of physical activity every day, playing in 1 or more sports a year. Those two are related, obviously. Getting at least 8 hours of sleep, and eating breakfast every day. So we're going to look at those wellness behaviors, those health promoting behaviors, in relationship to substance use and mental health and physical health. Let's start with substance use. And by the way, these data come from the Centers for Disease Control, the YRBS analysis tool. You can search this yourself. 2019, United States, across the United States, all high school adolescents. So let's start taking a look again. We're starting with There's a little introductory noise. 1 hour physical activity and sports participation. So here's the first one. So these are what we're doing. We're looking at crosstabs. By the way, these are all statistically significant. You can look to the right, see the chi-square. That's a statistical test showing that there is this association, which is likely to be real and not due to chance. We're looking at physical activity, 60 minutes, 7 days a week. And we're looking at the relationship between that, those who get physical activity, 60 minutes every 7 days a week, and those who don't. And we're looking at substance use. The first measure is had one drink before age 13. Now that is a good indicator of problem drinking in the future, having a drink before age 13. And if you look, you can see for those that, yes, physical activity, those that got physical activity, these are adolescents, actual US adolescents reporting that they got physical activity, 60 minutes, 7 days a week. You had almost 17% of those report drinking before age 18. But for those who didn't get that amount of physical activity, 14% had drank before age 13. So you actually see that drinking before age 13 was associated with being more physically active. So you may not expect to find that. But there's more, because you can see that if we look at physical activity and illegal drug use, we see it's the opposite. Those are physically active, less likely, 12%, to use illegal drugs than those who were not physically active, 15%. So a little bit of a flipping on the measure of physical activity and illegal drug use. How about current alcohol use? Again, we see that those physically active, by the way, I'm sorry, we're switching now to another measure. You can see it as playing at least one sports, playing on one sports team a year. And those who play on the sports team are more likely to drink alcohol currently in the last 30 days than those who didn't play on a sports team. Also, those that played on the sports team were more likely to binge drink than those who didn't play on a sports team. So let me summarize for you, because it could be a little bit confusing, because you have these dual findings with regard to physical activity and substance use. When we look at US data, high school substance use and physical activity data, we see that those meeting physical activity guidelines, 1 hour, 7 days a week, they're more likely to drink alcohol early, but at the same time, less likely to use illicit drugs. In addition, those who play on a sport team are more likely to be current alcohol users, and more concerning even, to be binge drinkers. That's associated with sport participation. So you see there's sort of a, this is and by the way, these are associations. At this point, we're not saying which direction they are. In other words, the substance use, does physical activity, is that come before and maybe even cause substance use, or is it the other way around? And is it causative at all, or is it just some other relationship with a third variable? At this point, we're just looking at associations. Tomorrow, we'll be looking at research that'll fill in the gaps and help us understand what we see with these data that I'm showing you, these national data. How about eating breakfast and substance use? Well, we see that for those kids that ate breakfast, 11% of those drank before age 18. Those who didn't eat breakfast every day, almost 17%. So eating breakfast associated with less early drinking, eating breakfast associated with less currently drinking alcohol, eating breakfast associated with less current binge drinking alcohol, eating breakfast associated with less trying marijuana the first time before age 13. Remember, that's a really important measure, because if you start a substance before age 13, that's likely to be a real problem, lead to addictions and other problems later in life. Eating breakfast associated with less current marijuana use. Eating breakfast associated with less selected illicit drug use. What can we conclude from those data? Eating breakfast and substance use. U.S. adolescents who eat breakfast every morning, less likely to try and to currently use alcohol or marijuana and ever use illicit drugs, and also less likely to binge drink alcohol. So all in the direction we would like to see, I guess, if you'd say, and that is eating breakfast associated with less substance use, regular use, initiating use, heavy use, or binge drinking. So unlike physical activity, where there appears to be maybe associated with less illicit drug use, but more alcohol use, and sports, more alcohol use, the eating breakfast all in the same direction, breakfast associated with less substance use. How about sleeping 8 hours or more? So you'll see a similar relationship to eating breakfast. Those who got 8 or more hours of sleep, less likely to drink alcohol before age 13, 10% versus 16% who didn't get 8 or more hours of sleep. Those who slept more are less likely to currently drink alcohol or 30-day alcohol use. 8 or more hours of sleep associated with less binge drinking, less likelihood of binge drinking. Getting 8 or more hours of sleep, less likely to try marijuana before age 13, to currently use marijuana, and to use illicit drugs. So like eating breakfast, 8 or more hours of sleep associated with less initiating and current use and even heavy use of a range of substances, alcohol, marijuana, illicit drugs, binge drinking. That's number one. Now, let me summarize this whole section on healthy behaviors, physical activity, meeting physical activity guidelines, playing sports, eating breakfast, and getting sleep. Number two, if promoting promoting daily breakfast consumption and 8 or more hours of sleep may help prevent the initiation, the current use, even heavy use of substances, alcohol, marijuana, illicit drugs among U.S. adolescents. Number three, again, a little bit more complicated. Daily physical activity was associated with less illegal drug use. However, it was also associated with those youth that were very physically active, hour a day. Those who played sports were more likely to initiate and to be current users and to be binge drinkers. So those individuals, those youth, those adolescents that are physically active and playing a sport, it may be important to target those individuals for alcohol use prevention. Now, again, these are preliminary recommendations based on, looking at these associations. We'll fill in the gaps tomorrow when we look at actual published research indicating which direction these associations are in, the strength of the association, and whether they're causative. In other words, whether physical activity may be linked, actually cause in some way some kinds of substance use, particularly alcohol use, and how and if breakfast eating and sleep may promote or prevent substance use. Now, let's shift gears. That was substance use, healthy behaviors, and substance use. Now let's look at wellness promoting behaviors and mental health. So we're going beyond substance use now and looking at outcomes. Again, same data set, youth risk behavior survey data, looking at crosstabs, high school adolescents throughout the United States. We're looking at 1 hour of physical activity in sports participation. And here, again, physically active individuals, youth that are adolescents that are getting the minimum amount of physical activity, less likely to feel sad or hopeless. That's a great indicator of mental health. And also 60 minutes of physical activity every day, less likely to seriously consider suicide. If we look at playing on a sport team, same relationships. Those kids who played on the sport team, less likely to report feeling sad or hopeless, and less likely to report seriously considering suicide. Now let's look at breakfast. Eating breakfast every day associated with less likely to feel sad or hopeless. I mean, there you almost see a doubling of the effect. A quarter of youth who ate breakfast felt sad or hopeless. 43%, almost 43%, who didn't eat breakfast reported feeling sad or hopeless. Same thing with seriously considering suicide, those who ate breakfast. This is a doubling. Here you got 11% of those who ate breakfast reporting seriously considering suicide. Almost 23% who didn't eat breakfast reported seriously considering suicide. How about 8 or more hours of sleep? Same kind of a relationship. Those who get sleep, less likely to report feeling sad or hopeless, and also less likely to report seriously considering suicide. So U.S. adolescents who got an hour of physical activity, played on a sport team, ate breakfast every day, slept 8 or more hours every day, were less likely to report feeling sad or hopeless, less likely to be seriously consider suicide. So increasing these 4 wellness behaviors, regular physical activity, sports, breakfast, and sleep, may improve critical mental health indicators among U.S. adolescents. Again, sort of going out on a limb with that statement, but we'll fill in the gaps tomorrow with the research. And I think you'll, since I've already looked ahead, the research I think will support the the statements that I'm making now. Associations among U.S. adolescent wellness behaviors and physical health. So now we're going to look at physical health. Here's 1 hour of physical activity in sports. One indicator of physical health is obesity. And we can see that youth, U.S. adolescents, high school adolescents, they get the minimum of 60 minutes of physical activity every day a week, less likely to be obese. They're more likely to eat 3 or more servings of vegetables a day, and they're also more likely to eat 2 or more servings of fruit a day. How about playing in a sports team? If you play in a sports team, those youth less likely to be obese, more likely to eat 3 or more servings of veggies, and 2 or more servings of fruit a day. How about eating breakfast? Youth that eat breakfast, less likely to be obese, more likely to eat vegetables, and more likely to eat fruit. And lastly, sleep. Those who got 8 or more hours of sleep, less obese, more vegetable consumption, more fruit consumption. So again, here we go. U.S. adolescents who get regular physical activity, who play in a sport, who get 8 more hours of sleep, and who eat breakfast are less likely to be obese, more likely to eat more fruits and vegetables. And so the recommendation is that maybe these 4 health behaviors, physical activity, sports, breakfast, and sleep, may reduce obesity and may improve the vegetable and fruit consumption, which is so lacking in U.S. adolescents. So this underconsumption of fruits and vegetables may be improved by these health behaviors. All right, that's it. That's the content for today. So I'm going to pause at this point, and I'm going to pull up a 3 quiz poll. So if you've been listening, this is your chance to show that you've been listening. So I've asked you 3 questions, a little quiz to see if you can answer these questions. I want everybody that can participate to please do. And this will sort of help us summarize what we've covered today. And we'll also see how well you understood everything. So if you get this, please do respond. We've got 3 questions. I just sent it out to you. Take a moment to get. The first question is, The first question, by the way, is a little bit of a tricky question, so read it very carefully. The traditional view of prevention is minimizing risk factors, but wellness is about all but. So you're going to try to pick out that one that's not the same for question number one. Question number two is what health risk does most U.S. adolescents not face? And so the sort of negative questions are a little tricky. And then lastly, number three, you'll have to scroll down to see number three. Adolescent physical activity, sleep, and eating breakfast are associated with all but one of these. So again, go ahead and answer these, and we'll see what percentage of you are correct or incorrect. We'll see if you've been listening. We'll see if I tripped you up with some of these questions. But this is a good test of whether you understood what we talked about today. And once we get done with this, I'm going to pause and we'll see if anybody has any questions or answers. So at this point, we don't have a whole lot of people online, which is unfortunate, but we have a lot of people responding to the questionnaire, which is great. We got the majority of you responding right now. We're 61% have responded. So please do answer. We'd like to get 70 or 80% of you to answer these questions before we pause at this point. And so keep up the good work and answer the three questions. Oh, I see. So we got, oh no, I was looking at the wrong thing. So really we got a lot more people online than I actually thought. So we got half right now have responded, 52%, 56%. So let's try to get up to 70%, 80%. Let's give you another minute to respond. We got 61% have responded so far. Very good. Thank you for responding. Please do respond so we can see if you've understood the content. This is the quiz right here to see if you really understood what was going on with the presentation today. So it's a little bit of an assessment of how well I presented the material, whether you understood the material, and all of the above. So if we could just have one more person respond, we'll be into the 70% range. Right now we're at 61, now we're at 71. So I'll give you 20 more seconds to finish the quiz. If you've started it, I don't want to cut it off while you're still doing it. So another 20 seconds and then we'll cut it off. We're up to 74% have responded, which is awesome. Almost 3 out of 4 of you. 3 out of 4 of you have responded because we're at 77% right now. That's amazing. So thank you guys very much for participating. I think it's really important to have everybody participate. We're at 78%. So let me go ahead, and we're at 80%. I'm going to stop at this point. And I'm going to share the results with you. So it'll take just a moment to get to you, but let me read it. So the traditional view of prevention is minimizing risk factors. That's true. But wellness is about all but one of the following. Now, some of you said it's all about, wellness is all about, wellness, let's rephrase it so it's better, easier to understand. Wellness is not about developing healthy habits. That's wrong. Wellness is not about integrating behavioral and physical health. That's not correct. Wellness is not about empowering you to choose positive behaviors. Not correct. But most of you responded, 70% said wellness is not about eliminating the need for prevention. Correct. Ding, ding, ding. Absolutely correct. Because remember, even within the definitions, the main components of wellness is it's prevention oriented. So it's prevention plus. Wellness is prevention plus. Wellness is holistic prevention. So most of you got that correct. Good for you guys. Question 2, what health risk does most U.S. adolescents not face? Vaping e-cigarettes? From the data we showed you, the YRBS data 2019, now I think the rates have gone down, but the data I showed you that 50.1% have vaped e-cigarettes. So using the data I showed, that's incorrect. How about C, physical inactivity? Remember the data I showed you? We've got only, what, 23% getting an hour of physical activity every day. So that is definitely a health risk factor. How about D, skipping breakfast? That's incorrect, because skipping breakfast, 33%. Only 1 in 3 adolescents in the US are eating breakfast. So all of those things are risk factors for mental and physical health problems. The one that the correct answer, which only 19% of you got, was obesity. Now, we really didn't show you what percentage of adolescents have obesity. I think it's in 20 percentile range, 20%, 20-some percent. So vaping e-cigarettes, the majority of adolescents, at least in 2019, according to YRBS survey, are experiencing. Most adolescents are physically inactive, according to recommendations for physical activity, 1 hour every day. Most are skipping breakfast, because only a third are eating breakfast. So that's an area I'm glad we have that, because hopefully that's correcting some misconceptions there. Last question, adolescent physical activity, sleep, eating breakfast are associated with all but one. Okay, so let's see. So all these healthy behaviors are associated with less, all but one, associated with less illicit drug use. That's true. So, that's, healthy habits, less drug use. So that's not correct. How about B, less mental health problems? That's correct. So that's not the answer. How about C, greater physical health? That's not the answer, because again, we saw that in terms of obesity, less obese and more healthy behaviors. So adolescent physical activity, sleep, and healthy eating are associated with all but, and that is D, less fruit consumption. And most of you got that right. 6 out of 10, 61% got that right, because actually healthy behaviors were associated with more fruit consumption, more vegetable consumption. So that's a little tricky as well, but I got some of you, stumped some of you on that. All right, thanks for participating. I'm going to pause at this time. I'm going to see, we have 3 questions. Jennifer asks, it would not work. The questions disappeared. Sorry about that, Jennifer. No worries. I submitted them, but I got an error. I hope mine made it in. Okay, so sorry about that lag, Jennifer, in the participate in the poll. No worries. We still got some response. Last chance to ask any questions. We got a few more minutes. Anonymous is, will we receive a copy of this presentation? So what you'll get is, I'll be emailing you today, so no need to respond to me, and I'll be sending you a certificate, and then I'll send you a link to our website where you'll be able to see, there'll be a link for both the recorded webinar and also on our website, the slides. So you'll be able to see those on our website, and you'll be getting that today. So no worries for all of you for any of that. Please share this widely with your colleagues and your friends. Remember, we've got part 2 and part 3 in the next couple of days. Even if you can't make it, make sure you've registered, because you'll have access to the recorded webinar, a certificate, and have access to the slides. All really, really important. And we do want to promote wellness as being essential to prevention. That's why we call it holistic prevention. And I hope someday we can actually have this be integrated within the training for prevention scientists. So thanks to Paula. It says great information to think about and to focus on. God bless you all for what you do for youth and families in your region. Have a wonderful day. Thank you for joining us today. And please come back for the part 2 and 3. Thanks, everybody. Have a great day. Bye-bye.